Dr. Lowell Clark's handprint extends beyond his community in Macon, from influencing almost every aspect of pediatric care through the Children's Hospital, helping the initiative in pediatric advanced life support, and helping establish the PICU, development of the Crescent House, a safe place for abused children, to pediatric patient sedation and procedural services. Dr. Clark also developed the Pediatric Critical Care Transport Team, caring for the critically ill and injured child in rural settings, while continuing to serve as a full-time staff intensivist. Dr. Clark's service to others has indeed been great. His career exemplifies honor, compassion, and integrity, someone worthy of a Lifetime Achievement Award.
If there's a guiding principle, it's make it work. That's whatever system we've got. Sometimes it's great, sometimes it's less than what you want, but just make it work and it'll get better. And that's kind of just do with what you got and make it work and things will get better. I can live, one thing you learn in intensive care is you deal with this. You deal with right here. Not there, not yesterday, not tomorrow, it's right there. That's what you have to deal with, and I'm still get lost in the moment a lot of times, and I guess just doing what's the work in front of you, and being around children. I mean, that children keep you young. I mean, that's, I mean, my good fortune's been history. I mean, it's just, when I came along, I fit into what was needed for the time, and that's just the luck of history. And the biggest luck I had was having wonderful parents.
While he really truly tries to take the patient's side, he will not do something like. So I mean, the guy has a lot of integrity in addition to all of his other attributes.
My son fell and nicked his spleen and became a patient here. Dr. Clark stayed with him overnight the entire time, held his hand, talked to him, made sure he wasn't fearful. And I've never seen a doctor with that kind of commitment, patience, or just sheer love as I have Dr. Clark.
Through it all, Dr. Clark started with us and Dr. Clark ended with us. And it was very appropriate for Austin. Austin felt very safe with Dr. Clark. Dr. Clark was very nurturing for him and very reassuring. He and Dr. Clark really developed a really great friendship and a closeness and a lot of trust.
What do you say about Dr. Clark? When I think of pediatrics, not only in the state, but in particular the Children's Hospital, I think about Dr. Clark. He is the compendium of devotion to pediatrics, but love for the children.
Lowell has always felt his patient's pain and has dedicated a substantial part of his wonderful career to preventing it, or at least making pain tolerable for critically ill infants, children, and maybe some adults. My knowing Lowell has filled me with gratitude because he has enriched my life in many ways, as he has so many others that are his patients and his friends.
As a physician, he is wonderful. He's caring, compassionate, the kind of physician that everybody wants. When I first met him, I was a critical care nurse in the adult ICUs, and just watching his work with his patients and his families was like, wow, I want to take care of patients with him. He's so caring and compassionate and so wonderful to work with.
I've known Dr. Clark since the early 1980s. I've always been impressed that he was probably one of the best bedside clinicians that I've ever been associated with. Dr. Clark was always known for having a unique ability to not only take care of a very sick child, he had outstanding compassion to work with patients and with parents as they went through these critically ill times.
His passion is contagious. Many of us nurses who've been around for a long time know what we know about pediatrics and have a passion for pediatrics because of working with him.
The other thing that is really quite alluring about Dr. Clark is he has a quiet force about him. He's an exceptional physician, exceptional clinician, He's the father of all the pediatric trainees in this organization. So the only thing I can tell you is this organization and this state and this region will forever be indebted to him, now and forever, because of what he established. He is going to leave a legacy and continue to build a legacy that is unprecedented in this part of the country.